Lynn Lipskis. This is my lovely husband, Ed. We practice together at the TMJ and Sleep Therapy Center of Chicago. Ed runs a separate entity, per se, in his orthodontic practice, the Center for Integrative Orthodontics. And our goal is to get people breathing well and making people healthy.
We treat people of all ages. We've got integrative systems that are set up in the practice where we have a chiropractor there who also does cranial. We've got an MRC clinic, within the practice too. So a lot of different modalities that can be employed in order to really find the best fit for what the patient needs.
Absolutely. Really, the MLS laser kind of is a miracle child for us. It helps with diagnosis and treatment of chronic pain. I had one lady that came in that kept complaining about pain in her face, and after I tested her, I kept saying, no, I think it's coming from your lower back. And fortunately, because we have the chiropractor in our office, we're able to go beyond our usual scope, and so we used the MLS laser to laser the area on her back that I had a suspicion, and all of a sudden her face stopped hurting. And it was so purely from a diagnostic standpoint. Obviously I'm not treating her back, I'm a dentist, right? But it was nice to be able to separate that out, because as a TMJ practitioner or chronic pain practitioner, if somebody's saying it's my face and you're listening to them and trying to treat the face when the source is actually somewhere else, then that creates a huge problem. So it's very handy, or very good for that, and obviously for reducing inflammation, there's nothing better. Inflammation is our enemy.
Right.
We're always trying to fight it, and the MLS laser is great at reducing inflammation, reducing pain, and helping people heal. So
I do a lot of lecturing, and so a lot of people coming into us are trying to learn these things from almost zero-based knowledge. One question we get a lot is, so there's a lot of things that you guys use. It can be expensive to set this thing up. If what's your priority in what you would get from an equipment standpoint? And both of our answers every single time is the MLS laser, because therapeutically it makes the most difference. It makes treatments go better. It makes patients feel better. It really allows us to treat them more effectively. All the other things are nice adjuncts, and they give you information, imaging, all this stuff like that. But from really getting the patients better, the MLS laser does more for us than any other piece of technology we have.
absolutely. One of my favorites is a young man. This was more like in the general dental realm. A young man got hit in the face with a baseball, and basically kind of this side of his face was, messed up. And he came to us as a dentist, straight from the emergency room after being stitched up, and so obviously to have us address his dental issues. And we started lasering him, and he came in, I think, for 3 sessions over a week period. Then he went back to the plastic surgeon who had done the suturing in the emergency room, and the surgeon was just flabbergasted because of the extent of healing. I mean, basically he had gone from a bloody mess to nice pink, healthy tissue in a week's time. That was awesome. I personally had an implant done several years ago, and foolishly, I didn't take any time off from work. I ran over at lunch, got my implant put in, went running back to the office, and it was starting to ache in the afternoon, so I started lasering it. I'm like, this is great, because I'm pretty much anti-pharmaceutical, and it made it feel a lot better. So all day I was like, every hour on the hour, I think I was lasering it, and I kept this up for a day or two. When I went back to the surgeon a month later or whatever, he was like, he kind of looked at me, and he's a friend of ours, and he goes, what the did you do? And I'm all like, uh-oh, I messed up. And he goes, I've never seen bone around an implant like this in a month. And literally, normally when you extract a tooth, put an implant in, you can still see the shadow, the cortical bone around the root of the tooth. that was completely gone. It was completely integrated like in a 4 to 6 week period. I mean, he was just astonished. I thought it was like pretty cool. But there's a lot of applications outside of pain and ortho. We use it in the general practice all the time, after, you know, post-extraction, post-endo, even after a restorative procedure, simply to reduce inflammation. A lot of people have sensitivity in their teeth, and that's a problem that you have to deal with. So it's nice to have the laser. You laser the tooth, it reduces that sensitivity, and you know, the patients are a lot happier, so that's great too. So. Well, the patients are always asking, like, what does it do? And so the short answer is it reduces inflammation and helps you heal faster. You know, and they're like, oh, okay, that's great. After that, patients are pretty good with it. You know, as Ed said, and I experience this too with mine, if somebody's in a lot of pain and you can laser them and then they're no longer in pain, that's like a real win. So a lot of times it helps people understand that you're on the right track. You know, kind of like the lady with the back thing. She came in demanding that I treat her face, and I'm like, well, it's not your face, it's your back. If I treat your face, we're not going to be successful. You can add me to your list of failures, sort of thing. And so then I was able to convince her, okay, now you have to go see the appropriate practitioner so that you can get well.
And when you demonstrate that this is effective at getting rid of the chief complaint that they have, even though it's not treating it in the way that they thought was correct treatment. We have diagnostic evaluations through Steve Olmos and John Beck and things like that that allow us to really find where the problems originated. And then the laser is an awesome tool to basically get rid of that issue, at least, you know, if there's a structural issue or something there, you don't get rid of it permanently, but you can show that that's the place that needs to be addressed. And then the patients, you know, clearly understand that, okay, this is where I'm feeling it, but this is where I needed it treated. And when that got addressed, this pain went away. So it's pretty convincing that that's the proper pathway to take.
And as far as doctors, basically I tell them the same thing. It reduces inflammation, decreases treatment time, makes treatment more effective, and helps your patients heal better. Then, you know, they're kind of like, oh, okay. And
we have a lecture on the laser that partly is from, you know, BioResearch provided some slides that they had, and then there's actually a fair amount of research on effectiveness of lasers in all kinds of different parameters. Like I said, there's, you know, research showing that accelerates, you know, orthodontic tooth movement, but there's, you know, research showing that when you're at the right wavelength, it will reduce inflammation, and different wavelengths are more effective for pain. You know, MLS has both, so that really works well with that. So those are things that doctors have a little bit more interest in sometimes. Although doctors, you would think that they would want to know more about, you know, the actual, you know, biostimulating mechanisms, but they just want to know if it works.
It's easy to use. It is nice if you understand the actual science behind it, but just like a light switch, it'll still work even if you don't understand all of the physics. It's relatively inexpensive for what you get, and once again, in dentistry, you know, if you have a general practice, you can apply it across the board. In our specialty practices, we use it all the time. I mean, basically every patient does get lasered. It's a great tool if you're interested in actually helping your patients feel better and get healthier. So,
yeah, no, those are the bottom line things. The mechanisms, you know, are awesome, and they're out there, and it's not voodoo. There's actual science behind it for those who are interested in that. And again, research, you know, is out there supporting its use in many, many ways. But it's essentially, you know, the biostimulation effect. You know, more precursors for me for new bone formation come from the blood supply when you laser than when you don't laser. So that's part of what accelerates the changes my patients. But it's just, inflammation is the enemy for these patients. Inflammation is what makes them less comfortable. So, just having your patients, being happy and not hurting, for me, from an orthodontic standpoint, they talk about having braces before and how much more it hurt last time compared to what it hurts now. So, that's a combination of both the light forces that we use, but the laser makes a difference. If you have teeth that are wildly arranged, there's still going to be some inflammatory response, no matter how light the force that you try to engender, but the laser will mitigate that and make the patients just feel better.